Well, the challenges are many right now. One is there's so much legislation that's floating around, and there's so many requirements that are being placed on the providers. And you can go all the way from meaningful use requirements to PQRS initiatives to pay for performance programs. It's a very, very confusing environment and confusing time, and that doesn't include things like ICD-10, 5010, which you hope to have a minimal impact. So a lot of changing environments. Everybody's in the process of trying to adopt or make a decision around an EMR. What does that mean? What does this attestation mean? And so the challenges that are out there are one of a lot of people trying to help in the delivery of healthcare and them figuring out how that plays, what they should do as a practice, how do they make decisions. From an emdeon perspective, we offer not only our own solutions, but we're very tightly integrated with really most of the EMRs, for example, in the country. One of the challenges in accountable care organizations, as they look at it, is they're all on disparate systems. So they may have one EMR, even where you have a large system and they've tried to implement a single source, let's say EMR across their enterprise, is very challenging. It's a long time and it's very consuming. emdeon is connected with almost every EMR vendor in the country. We deliver claims, for almost every practice management system in the country. We're delivering remits, so we have payment information. We have clinical data that's within claims. We're doing lab orders and results as well. So when you take all of that and you put it together and you think about it, think about a populated HIE, so to speak, when you think about emdeon with a network of connectivity. Or studies have been done that actually talk about preventative care actually lowers healthcare costs. And yet, a physician that I was talking to recently, when he was talking about hospital readmissions, and he was a primary care physician, he said, if I knew that my patient went into the emergency room and I was able to deliver that information, if my patient was able to tell the hospital that I'm the primary care physician, and if the hospital actually delivered the information back to me that said I had a patient that was in the hospital, I would actually be able to manage that patient on to help prevent readmission. So patient population management in its simplest form is understanding the care that a patient should be getting, making sure that the provider's informed and has the mechanisms to be able to reach out to their patient and deliver the service.